Thank you, Saul. So hello guys, my name is Talvo. In this section, I will provide an overview of the barriers that occurred during the implementation of a new electronic health record system within their healthcare organization. I've had an existing HR or have been working with paper charts all along. So the roadblocks for a newly electronic medical record system can include organizational constraints, technical limitations, standardizing issues, and cost constraints. So I will be talking about a few roadblocks. Extensive training time. Having ineffective or poor training can disrupt the implementation of a new electronic health record system, EHR. Example, an inefficient or incorrect use of the electronic health records, as errors could occur during the process of training, which can increase the risk of malpractices for lawsuits. Or for employees that do not use electronics and need more training to get used to the system. Implementation costs. Implementing the new HR will be vital but costly, as we will need to pay high costs for putting it in the whole facility for flawless interoperability, and high maintenance costs will surely follow as updates and potential breaches can occur. The return on investment (ROI) will rarely produce an actual cash payment for valuable data analytics to help benchmark against competitors. Quality of output and documentation. The quality output can be difficult as what is printed from the HR may be difficult to read, and that can be a problem when faxing another healthcare facility for continuity of care, and with that problem can occur with legal issues if attorneys cannot read that patient's medical records. An example, at my hospital that I work at, Evergreen Health, we had issues about an ITA, which means an Involuntary Treatment Act, which is a petition for people that pose a threat to the public and to themselves. And we had technical difficulties sending that information because of a recent update within our current HR. And if we don't present those records or if the notes are not legible to the court, it can delay the process, which is a legal matter for the hospital, and it creates way more further issues than just technical difficulties. Empowering employees. We will make employees feel that they are valued even with the new changes. Keep lines of communication open about the issues that occur when implementing a new HR. Encourage skill development within that training so that we can help inspire the employees that this is not a roadblock, but to help make their job easier and more productive than waiting for a fax to be sent. These actions will help break down the barriers that occur when implementing that new HR system. Interoperability. Having a well-built design in place to create seamless interoperability between all systems so that the clinical staff can easily transition with little training will be crucial to success for the most significant barrier, which can be cost. Having a facility merge with a new HR will have challenges as there are standards that need to be met with the existing procedures that are in place. The physical, administrative, and technical safeguards of protecting the organization will be the job of all the employees. And that can be a big barrier as well, because employees will have to fight the change. They will fight the change. Implementing passwords can be a challenge. Different paths of organization access will be also difficult, and the lack of job security because of that new information of that HR. Which is vital that short-term wins can help the development of training new and existing employees and skills needed within that workplace. To help create a smooth transition, we will need to create procedures and standards so that everyone can understand the guidelines of how the system works. Once that is done, we will make sure that our employees have access to what they need so that there is open communication. And lastly, we will create a specific classes so that the training is appropriate for all levels of users and understanding that new HR so that it can be a win for all levels. All right, thank you guys.